So the first thing I'm going to go over is provider assignment as a mid-level. Currently I'm signed in as Starla. If you notice that this testing mid-level has been assigned or admitted to Starla, so she is the attending. That's why it shows up in her first tab on the inpatients/emergency tab. If you double click the patient, it opens up the chart. If you look at the top of the header strip, you can see that the attending is Starla. So right now we're going to assign Starla to this patient with the preceptor field populate so we can put in the overseeing MD that is going to be overseeing all of the mid-levels, depending on your specialty. So we're going to go over to provider assignment, which is on the left-hand side of the screen. And in here you can see that the attending/visit has already populated Starla's name. This is coming over from our registration system, Affinity. But right now, because it's already defaulted, the preceptor field doesn't populate. So what we need to do is go into field 1, and we're just going to type in the start of the last name. So as the mid-level, you're going to put your name here with a dash and hit enter. You're going to search and find your name, and you're going to select it. And now after you repopulate field 1, the field 2 of the preceptor comes up. So you're going to go into field 2, and you're going to type whoever your preceptor or overseeing MD is. So right now I'm going to do Addie with a dash. So you choose the MD, and then you can choose the medicine service options for him. We're going to pick OB. And then you're going to hit enter until you get the A to accept. Make sure you always accept or it won't capture your documentation. So if we go back to provider assignment, we can see that Starla is the attending/visit provider, but the preceptor is Dr. Addie. This doesn't drive anything within the system, but it's a good visual to see who is the overseeing provider for all those mid-levels. This is going to be the same for Charmaine and Tony, the nurse practitioner and PA for the hospitalist. It's the same workflow. Now I'm going to show you how to assign the patient to you if you are not the attending or the admitting provider. So currently I'm signed in as Charmaine, so I'm going to go up to the group tab. So the hospitalists all have a group, and same with the health dimension clinic. So all of the mid-levels and the OB doctors have their own group, and the hospitalists have their group that will oversee the mid-levels in a whole. So we're going to choose, let's do short stay. That patient is going to be assigned to Charmaine. So she's going to double click on that patient. And right now, if you look at the header strip, the attending is Dr. Brown. So we're going to go back over to that provider assignment, and you're going to choose field 1. And right now, if you see, it's going to populate Charmaine's name in there. So you're just going to hit enter, and the preceptor field populates. So we're going to go into 2, and we're going to fill out that the preceptor is going to be Dr. Knight. So I choose his last name with a dash, find the correct Dr. Knight, and hit enter and enter till I accept. So now if I go back out to the main desktop, refresh my screen, and go over to my inpatient tab and refresh, I will now see short stay listed under Charmaine. It still has the attending as Dr. Knight because that's what came over from Affinity, but when you double click into the patient's chart again, provider assignment, here's your visual. The admitting was Dr. Brown, the attending is Charmaine with the preceptor of Dr. Knight. The next topic that we're going to discuss is the discharge order entry by the mid-levels. So I'm signed in as Charmaine right now. I'm going to go choose my patient and go down to the patient visit. Before the discharge order is placed, med reconciliation needs to be done on the patient. The reason med reconciliation needs to be done prior to the discharge order is so that the nurse knows when the discharge orders and the meds come across on their screens that the patient is ready to go home. So we're going to pretend med rec is done, and I'm going to go order the discharge order. So we're going to go to order management, select our problem, and add order. The hospitalist discharge orders are under the hospitalist menu, and the mid-level for OB, they're going to be under your OB folder for your short stay or your inpatient discharge. So because I'm signed in as Charmaine, I'm going to go to the hospitalist menu and go order the inpatient discharge and add order. Now it's going to drop you through all the fields
that are required to fill out for discharge. The first one is the discharge type. The patient's going to go home without any services, no home health or no hospice, so it's just going to be a routine discharge. If the patient goes home on hospice, you're going to want to choose the home with home hospice, or if they go home with home health, you want to choose the home with home health. But we're going to just say that they're a routine discharge. So I'm going to choose the diet. I'm going to choose a regular, and then I'm going to hit D to add another because I want to choose to tell them to increase their fluid intake. The reason why you have the ability to document more diets or more activities at a time is it lists them out in a nice listed format. Therefore, all of these orders goes to a custom report to the patient. So it's listed out in an easy format for the patient to read if you do it this way. So we're going to hit OK. Activity. I'm going to just do as tolerated. They don't have any equipment, so I'm going to skip it. They don't have a wound care, so I'm going to skip that. Follow-up instructions. So this is the field that you are going to go into to tell the patient when to follow up with either their primary care physician or a specialist, or if you want to have them continue home health, if you want to start home health, or any referrals you may need to make for the patient would be under this referrals home health area. We are going to be adding a referrals for a diabetic outpatient referral, so that will be there as well. So we're going to just say that they're going to follow up with their scheduled appointment, and I'm going to also say home health services every 3 days for 6 months. Hit OK. So the call MD field, that's if the patient goes home and we need to educate them to when and if to call the doctor or the hospital back. So you would just choose what is applicable to your patient. I'm just going to choose a couple. To follow up with primary care physician, this question is that simple. It was, did we follow up with the primary care physician? Were they notified about the patient's stay in the hospital? The reason to add this question is more for continuity of care, to let the primary care physician know that their patient was hospitalized for a certain reason. It is a yes or no. If you choose no, a reason will come up and you can free text the reason you did not get a hold of their primary care provider. Patient didn't have a PCP but provided a list. The VTE, stroke, and AMI discharge questions, those are our core measures. If your patient falls into any of those measures, you will say yes, and then it will open up more questions to kind of guide you through the treatment for discharge. I'm going to say no for them. Now I'm going to choose order summary and accept my order. After you accept the order, it is active for the nurse to carry out the order and send the patient home. So the provider that's covering all the mid-levels, whoever is on during the time that the discharge order was written, will need to be the one that signs off the order. So I will show you that process on the next screen. The next thing I'm going to show you is how the provider that is overseeing the mid-levels is going to sign off the discharge order. So currently I'm assigned in as Dr. Knight. I'm going to go to the group tab to find Charmaine's patient. So the group tab is based off of groups that we set up behind the scenes. So we have a hospitalist group and we have a health dimensions clinic group. So inside the hospitalist group will be the MDs and the mid-levels, the PA and the NP, that are all work within that hospitalist group. And same goes for the OB group. We have the health dimensions MDs and we also have the midwives in that group. The group tab is how the MD providers are going to go and sign off the mid-levels discharge order. So currently I'm going to go into Bob mid-level patient because that's the one Charmaine wrote the discharge order on. And you'll see in the patient's inbox, you'll see orders, and you'll see the discharge order that was written by Charmaine. She was the order author. for today. So you need to double click on that order, and this will then give you a screen to review all of the fields that she entered for that order. If everything looks good and you agree, then you can sign the order by hitting this yes down below. If you don't agree and you don't want to sign it, you hit no. If you want to reject or discontinue that order, you can. But keep in mind that this discharge order, once Charmaine or any of the mid-levels enter the discharge order, it is active. Therefore, the nurse can carry out the order and discharge the patient. Sign order, you're going to say yes. That clears it from the inbox. So I want to go show you what it actually looks behind the scenes on the audit trail. So if you go to chart review, and we're going to go over to the order blocks. I'm going to choose the discharge order that Charmaine wrote and review the order. I'm going to click on the new order that Charmaine entered and then hit this audit trail. So it shows that Charmaine created the order at 8:33 or 8:30 and that Dr. Knight, the MD, went at 8:33 and signed off the order. So in the audit behind the scenes, you can tell that the mid-level entered the discharge order, but it was oversought or seen by the provider. The next topic we're going to discuss is documentation within QuadraMed for the mid-levels. So the mid-levels can document two different ways. They can do a direct entry, meaning they hand type their admission H&P, progress note, discharge summary, transfer summaries, death summaries, or they can dictate those exact notes as well. This slide I'm going to show you how to do the direct entry notes and tag a cosigner so that the provider can sign off their notes. So I'm in as Charmaine and I went to the patient Bob mid-level. I'm going to go over to the left-hand side to direct entry notes and scroll all the way to the bottom where there's a header that says direct entry all. So you'll see that we have a direct entry note for progress notes, H&P, transfer summary, and discharge summary. The progress note has a single field entry, which means that there's just one Word document that pops up that you can type in. The SOAP style will have 4 different Word documents that come up, one for subjective, one for objective, one for assessment, and one for plan. So right now I'm going to choose the admission H&P. The next screen is going to ask you to document the date and time when the H&P was performed. So we're going to say no. And the Word document comes up. This is where you will document the admission H&P. Oops. When you're done, you will go up to the X and make sure you hit the Save button. After hitting Save, the Word document will formulate it into QuadraMed, into this field. The next field, this is very important, that you put in the MD that is overseeing the mid-level. So right now I'm going to put Knight. You can do last name with a dash, and it'll search the database for that physician. Double click on that provider, and then you get your A to accept below. Make sure you always hit A to accept to sign your note. If you forget, you will lose the note and there's no way that we can recover it or find it. So now I'm signed in as Dr. Knight to go sign off that progress note, or that H&P that Charmaine had wrote. So I'm signed in as Dr. Knight. I'm going to go over to the sign dictation queue, and I'm going to see that there is a progress note and an H&P that are unverified that are written by Charmaine. So you're going to double click and you'll be able to review and read their H&P. You're going to want to hit edit down below, go into field 1 to the H&P. That brings up her Word document that she was typing. And then at the bottom of her Word document, you're going to want to put your statement that you had overseen this patient, or you agree with her above findings, or you did your own assessment. It's just more documentation that the mid-level did the H&P or did the progress note, but also that you had laid eyes on that patient as well, and that you agree with her findings or did an assessment yourself. That's where you're going to dictate to be attached to her documentation. After you're done putting your little blurb in, you're going to hit the X and the save. And you're going to hit OK, and you're going to accept. And then it goes away. So you're going to do the same thing, edit, go into the field, review her documentation, add your own blurb of assessments, agreeing with the findings, etc. Hit the X, hit the save, hit OK, and accept, and now your inbox or your queue is cleaned out. After Dr. Knight has signed the documentation by the mid-levels, I'm going to show you in the audit trail how it looks for auditing purposes. So if you go to chart review, all physician, we're going to go to that admission H&P that Charmaine wrote that Dr. Knight documented or co-signed against, and hit the audit trail. So it shows that Charmaine documented the direct entry note at 8:55, and that Dr. Knight went in there and added and verified and signed it. And that makes the status complete. So it's unverified with Charmaine, and then it makes the status complete. We're currently going to go over how to do the documentation via dictation from the mid-levels to insert a cosigner field and have the primary MD be able to sign off the mid-levels documentation. So right now I'm signing to Charmaine. I'm going to go over to the sign dictation queue. I have already currently did some test dictations through our dictation system. So I'm going to go grab the admission history and physical on Bob Midlevel. You'll see that the dictation is there. They're going to hit edit results and click in the report field. They're going to read through the report and make sure that there's no changes or anything that needs to be updated. Once they're okay with what it looks like, they're going to hit the X, and then in this cosign by field, they're going to hit and type in the overseeing MD. So we're going to do Knight again, last name with a dash, pulls up the physician, enter, and then enter again, and you want to hit that A to accept. Once you do that, it goes away from the mid-levels dictation queue. So we're going to do the same thing with the hospitalist progress note. Double click, edit results, click into the report, read it, make sure that it hits everything they want, go ahead and hit the X, go into the cosign field, last name of the provider with a dash, choose the provider, hit OK, and A to accept. So now the mid-levels have signed off all of their dictations. They are currently unverified until they are co-signed by the MD. So I'm currently signed in as Dr. Knight. I'm going to have him go to the signed dictation queue as well. And there you will see Bob mid-level, the two notes that Charmaine dictated and signed, for him now to be routed to co-sign. So we're going to double click on the admission H&P, edit results. They're going to click into that report field. They're going to read their dictation, and then at the end, just like the direct entry ones, they're going to add their own little blurb, whether they agree with the above findings, if they have any additional supplemental information they want to add to, they will add it there. Once they're completed with what they want to put into the dictation documentation, they will hit the X and save, and then OK, and then accept. And do the same thing with the progress note. Edit results, click in the report field, read her dictation, add your supplemental information save, and then you're going to click OK, and then A to accept. Once you've done that, leave those queues, and you have co-signed the mid-levels documentation. Right now I'm currently in chart review. I just wanted to show you a visual of behind the scenes audit trail on how this will look. So here's the admission H&P that Charmaine did, that we had the MD co-sign. If we hit the audit trail, we can see that it was resulted by Charmaine. She signed it, and Dr. Knight went in there and he signed it. So it was unverified status with the mid-levels, and then it was a complete status with the MDs after they co-sign it. So these co-signing of either a dictation or their direct entry notes need to be done for all of their notes, the admission H&P, the progress notes, transfer summaries, discharge summaries, or death summaries. If you have any questions with any of the workflow provided within these slides on the mid-levels documentation, the role as a mid-level, or the provider's role, please reach out to Informatics at extension 8586, or we have an on-call phone 24/7. It's 371-0001. Thank you.